Okay, hi everybody. I'm Kia. I'm from BHA for Equality. I'm the Community Engagement and Development Worker. So I work for the PASH Partnership, which is essentially a partnership between BHA for Equality, LGBT Foundation, and George House Trust. And we cover sexual health services across Greater Manchester, and in particular, my focus is on the BAM community, so Black, Asian, and minority ethnic communities across Greater Manchester. I'm joined today by my colleague Jeff. Would you like to just introduce yourself?
Hello, everyone. My name is Jeff Okiwi. I'm also a community and development worker for BHA for Equality. I work within the same capacity as Kia, so we do almost similar job actually. But I work for the Hive project, which is a project that also sits within the PASH partnership as well. But our aim is to end all new cases of HIV transmission within a generation. So I frontier I'm on the front line trying to push for that in the community. Yeah.
Mhm. Okay, so the topic that we wanted to focus on today was Black men in particular and the need for them to focus, and as a community as well, for us to focus on their sexual health. So that's why I decided to ask my colleague Jeff to come along, as he seems to be an expert in that particular field. So let's get started, I guess.
Yeah. So when it comes to Black health, we know that a number of factors are responsible for that. So like there are struggles when it comes to Black men assessing sexual health, and it is our responsibility to raise this awareness within the community and to be able to challenge some of these barriers that prevents accessibility to 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 healthcare settings by especially men within the BAME community, which is a struggle, you know. So Kia, I don't know if you want to talk about a bit about what I know I'm a man, but what does sexual health mean for the Black man? If from your own perspective, what do you think it means?
I definitely think within the Black community as a whole, when it comes to sexual health, there definitely needs to be a focus on how sexual health is generally something that needs to be focused on as a part of general well-being. So how the effects of not managing your sexual health or having concerns about your sexual health can essentially end up bleeding into other areas or effects on your general well-being. So when it comes to sexual health in particular, there are a lot of different reasonings as to why it is stated that Black men perhaps may not access services for sexual health queries, concerns, or even when it comes to testing. So I've just noted here some of the reasonings as to why. So the first one would be access. So if we were to define access, access is defined as the means or opportunity to approach or enter a place, which essentially means that potentially it may be that Black men do not actually have the access to sexual health clinics in terms of locality or in terms of them being aware of the type of resources that are actually out there which are tailored towards them. A lot of the resources that are out there sometimes may not necessarily be culturally sensitive or culturally aware of the different factors as to why Black men may not want to access sexual health services. What would you like to give some input on that, Jeff, from your perspective?
Yes, opportunities. Yeah, when I look at the stats, when I look at the comparison with women, you find out that you know the women have lots of reasons why they go to the access clinic settings, and as a result they're open to a lot of these informations out there around keeping themselves safe and information around condom. But men might not have those kind of opportunities, and if, for example, if they don't live within the localities where their clinics abound, that can even prevent the willingness to want to engage with those sexual health clinics. For example, if I live somewhere here in Moorside, and then my clinic, my if I have sexual health in maybe Cromsall or North Manchester, it takes me about an hour to go there. And why should I travel all the way? I don't feel. I feel okay. I don't feel unwell. I'm strong and I'm very potent sexually. So what would be the reason for me to go, to those places? And if there are no community interactions around or interventions around awareness, around provision of information, that can actually prevent men from accessing the information required to go there. If they're aware that there are clinics about clinics that resides within their community where they can go and access condom, or they can go and have one-to-one discussions with a clinician around their health. That in itself will not be the serve as a motivation to want to go there and to want to go to these places. So it is important that even as community engagement workers, we should to have those kind of interactions within those individuals within the community to get them to really engage with sexual health settings, and also the sexual health settings or clinics have to make themselves known to the men within this community. Okay, we are here for you to assess us. They have to promote themselves, because normally people wait for themselves to be healed, extremely healed, before they assess clinic settings. Yeah.
Yes, 100%. I think moving forward, the next point is quite common that we come across in terms of fear. So, fear is defined as an unpleasant emotion caused by the threat, danger, pain, or harm. So, definitely, when we're interacting with Black men in particular, often when we were previously in community, there may be conversations around the fear of people knowing their status, or people knowing that they're actually accessing sexual health services. And also, we will get on to it later in the presentation, but the fear of mistreatment when they actually access healthcare services, and how conversations around their sexual health practices will actually be discussed. What do you think, Jeff?
Yeah. For example, the stigma. Stigma is a problem.
Mhm.
Um, a number of factors actually. Um, Societal perception of of illness, for example,
Mhm.
HIV, or syphilis, and even gonorrhea, you know, or the cultural perception actually might actually prevent,
Mhm.
because some people might be worried that when they go and get whatever information around their health, and maybe, for example, they go for tests and the test comes out positive, that can actually prevent them from really, wanting to even engage further, because automatically there is this inherent stigma that lies within, and also the potential stigma, the potential external stigma that will come from members of the family, from members of the community, and all that. So all those have impact on on the accessibility to
Sex.
healthcare settings. Yeah.
Yes. So then moving forward, lastly is agency. So agency, in reference to sociology, is defined as the capacity of individuals to act independently and to make their own free choices. So, this is whether or not Black men necessarily feel that they have the agency. And if they do have the agency in terms of having enough education, in terms of resources around sexual health to make those choices, it may be the possibility that they're choosing actively not to access services. And that is why the first 2 points that we brought up in terms of fear, stigma, access are crucial to look into, because if they're using their agency to actively avoid services, we need to focus on what shift needs to actually occur and what changes need to be made in order for them to think about how sexual health needs to be a primary focus of theirs. So, moving forward,
Yeah. Yeah. Go on.
would you like to comment? Sorry, first, Jeff.
Yeah, I think like we talked about before, it is about the awareness. It's about awareness, getting men to understand that they have the responsibility to make the decision themselves. They don't have to wait for them to be sick first before they present themselves to the hospital, because we know that it's a saying that goes like this: that prevention is better than cure. So why wait for yourself to be sick, extremely sick, before you present yourself at the hospital? Because whether you like it or not, if you don't, even if you don't want to go to that hospital or that
Mm,
clinic setting, your sickness will force you to be there. Before you know, you wake up in a hospital bed,
mm,
carried by the ambulance down there. So it is important that you make that choices, but also need to be able to raise that awareness and get them engaged and to become more responsible about the need
mm.
to to look after themselves, look after their sexual health, and be more interactive with clinicians.
Yes. So now this section, we're going to focus on just generally the mistrust as to why there is mistrust when it comes to sexual health, and in particular why Black men may not feel comfortable to access services. So the first example that I'm going to use is the Tuscany. Sorry, Jeff, go on.
Yeah, yes, there are mistrust. There are mistrust um, in a number of areas.
Hmm.
We know the history. There's historical redress that needs to be made. We know the history in the past of of the neglect that have been faced by Black people and the social injustice that has been perpetrated against Black people, and all that fits into the narrative that that if we go to the white, so if we go to healthcare setting, it is an extension of what happened in the past. So they become very, 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 very uncomfortable assessing. During our discussion in communities with individuals to test for HIV,
Hmm.
and many of the conversations were, "Oh, do you know what's in there? There might be other infections that they want to impute in you, and you know, it's happened in the past where genocide, there's been gem warfare and all that in the past. So this might be an extension, or this is a new age form of eradicating the Black race. So some of these things like that,
Hmm.
you know, um, on their willingness to want to engage with healthcare settings and get the right information. Yeah.
Yes. One of the primary case studies that I thought would be useful to look at is the Tuscany experiment, which occurred from 1932 to 1972, which essentially was an experiment or research which was conducted in which Black people, African Americans in particular in the States, were utilized within a study where essentially they were given syphilis, and that syphilis was untreated. So they were left with syphilis and it wasn't treated in order to study what the effects of that would be. And even when research developed and they did actually find a cure, it was stated that some of the participants of that study weren't made aware of what they were actually given, and also they weren't given the cure for that. So this is a primary example, and it's often referenced when people are talking about why potentially Black people in particular, may not want to access services, because there's the fear of them essentially being used as guinea pigs for medical advances. So then when we
Yeah,
context, sorry, go on, Jeff.
it is a shame that this happened in the past, and yeah, so stories of this kind can really impact when people hear stories like this. How would they be comfortable in terms of accessing the healthcare settings? So
Mm,
yeah, this can cause, but I think it's also important that we, as much as we know of these stories, but we need to make that things have changed, things have moved on from
mm,
what it was, and then individuals like us who are really pushing to ensure that the trust is restored, and
yes.
some of these historic experiments are being redressed, robustly, and to ensure also that there's no repetition of that. And that
Yes.
is why we are infiltrating the system to
Mm,
ensure that such things do not happen. But individuals also in the community have to trust us to be able to provide them with the best information,
mm,
and to to make them aware that their health is important.
Yeah.
And yeah,
So then moving forward in terms of if we think about in the UK, especially in recent times, when we're focusing on topics such as COVID-19, well, not topics, but situations such as COVID-19, the topic of medical racism has come up more frequently within the Black community in particular. So this could also be another deterrent as to why Black men may not be accessing services because they do not trust the communities, well, not the, yeah, the communities and individuals. They do not trust authorities when it comes to the education that they're being given in order to actually make an informed choice. And when it comes to public health messages, although they may have the best intentions, those messages may not actually be correlating to Black communities or Black men because there's already that establishment of distrust. So when we're talking about what Jeff previously mentioned in terms of having this distrust and how that's actually remedied, having people visible such as ourselves within the community, it can actually enable people to focus on the fact that there are people from our community who are educating themselves and who are choosing to go out and inform and encourage people from the same community to empower themselves with that same knowledge. But at the same time, there does need to be acknowledgement of the fact that there is a reality in some services. People may be approached with an experience which is not pleasant for them in terms of healthcare settings or when they're going out into sexual health clinics that essentially may put them off from accessing services. So we do need to think about ways that we can actually remedy that. So then moving forward, we need to focus essentially on our practice. How is this currently affecting Black men's sexual health?
well, we know that there's a high. If you look at the statistics, I don't know if you have some statistics there to present, but we know that um, it's impacting astronomically.
Mhm.
We know that men are very, when it comes to late diagnosis, the numbers are high amongst men, especially being from BIM communities.
Mm.
They don't want to attest to, and also there's late diagnosis amongst men as well. And men are more likely than women to drink alcohol if we have to look at it from a broad sense, above recommended levels. So you can see that when they drink alcohol, they find themselves in a very compromising situation, and they engage in sexual practices, which then might lead to infections, and so men use a range of primary care services far less than women because um, women tend to always want to go to A&E. If they're sick, they just want to go to A&E because they interact with sexual health service men on a constant basis. So there is usually a requirement for them to carry out holistic examination of their health. For example, women go for family planning. They go for pregnancy tests, antenatal care, and cervical smear. All these are reasons why women go. But men, we don't have that kind of constant interactions with this kind of misconceptions and the mistrust,
Mm.
and the lack of provision of information. All that can impact on the health of men, of men.
Yes, I definitely think it's important to highlight that. I definitely think when it comes to primary care services, there's a variety of different reasons as to why men may not necessarily want to go into those services. And naturally, for some women, they may choose to access those services, but there also needs to be a rebalance in terms of whose responsibility it is to focus on individual health. Um, so that's a very topical conversation that needs to be focused on in terms of how Black men can actually be having more of a focus on their own individual sexual health and as to why they may not necessarily be seeking out services. So some of the reports and stats that I did have a look at basically stated that there could potentially be embarrassment to visit sexual health clinics for younger Black men in particular. And this could be for a variety of reasons, depending on locality, whether that's necessarily a norm. Typically, for students or for people who are at university level, sexual health is more of a recurring conversation. But if we're focusing on people that are more so 16 or under 18, there's also that embarrassment level of not wanting to reach out to services or potentially feeling shame or cultural shame and the repercussions of reaching out to services. But then, even at an older age, there's still the potential for stigma and cultural stigma of not necessarily wanting to reach out to services and their presentation and standing within their community. So there's also the fact that social economical backgrounds can also play a large factor when it comes to education and the understanding of sexual health needs. So this is not necessarily to say that all Black men are necessarily from lower social economical backgrounds. It's
Mhm.
just some of those ones that are from lower socioeconomic backgrounds may not necessarily have the tools that they need to utilize in order to make more informed decisions. And also, when we focus on locality, what resources are actually present within the area that they're in. So, for example, if you're living in more of an isolated area or you're not near a predominant city, it could be the potential that you don't have as much access to resources or accessibility to visit a clinic. And depending on different factors such as racism, you may not necessarily want to venture out to particular clinics for fear of how you may be treated when you do go to those clinics. So another
Yeah,
fact, sorry, go on.
sorry. You also think about other reasons actually why men do not, how all this can impact on the health of men. You
Mhm,
know, some sexual health conditions do not manifest themselves in men.
mhm,
Um, because they don't know those conditions already abound in them, and
mhm,
the need to go to a clinician to examine whether they have infections or not will not be there because they're not having any until it germinates to a point and grows to a point where it then becomes a problem.
mhm,
So, and also we also know that the responsibility, domestic responsibility of men as well impacts on their willingness or their availability actually to access social health clinics or to become mindful of their own health because all the time they're working, they want to make money, especially from the migrant community. They want to make money and make money. You call it, that's for many of them the reason why they left the country. It's not because they prefer to be here, because they
mhm,
left the country because they want something better. They want they want to be in a place where they can they can be in some kind of greener pasture.
mhm,
So they come here and they sort of work and they fall in love and they have kids and so all that impacts on them. And they have to pay bills and tax as well, and some kind of disability as well. If there's an existing disability in one area, one aspect of your health is in deplorable state. For
mhm.
example, you have high blood pressure or you got kidney problem and this thing, you wouldn't have the time to look after your sexual health because that's wouldn't
Yes.
really bother you and all that. And also you have to understand that for men, when it comes to utilization of condom, some people feel that it takes away the spontaneity of sexual interaction because you're looking for condom when the whole excitement is there. So all that just why you just shift those through while you're talking.
Mhm. Yes, I definitely would agree with a lot of the factors that you that you brought up, just in the sense that we do need to not just look at Black men as though to say they're a singular group and that there's no differences between Black men in terms of how and why they may not be accessing services and the different concerns that they may have. So one of the factors that did come up, one of the stats that I found was that 16.6% of Black Caribbean men were least likely to use or try to use their general practice surgery prior to gum clinic attendance. So it's really important when we contextualize that just to think about the factor that if they're not necessarily going to GPs to check up on general health, there isn't that active knowledge of how you need to be recurringly checking in about not just sexual health, but just general health practices and having those regular updates. And that concurrently does work alongside sexual health, having the practice of focusing on how you need to be recurringly having sexual health checks, but also checking in to see what is actually suitable for you as well. Because sexual health is not just a period of time where it's just one isolated situation, it is a lifelong commitment that you need to make in terms of thinking about how you can protect yourself in the best way possible, and also considering your different circumstances. Different forms of contraceptives may suit you at one period of time, and then at another period of time something else may be more suitable. So definitely factoring that in and having those conversations with a GP would be more beneficial, in contrast to just solely not visiting, essentially. So then when we look at another factor of how this is currently affecting Black men's sexual health, there is the capacity to impede on how they're able to make informed decisions, because this is not necessarily due to their own personal lack of education or lack of understanding, but acknowledging the fact that there's sometimes distrust and the desire to have more agency on their own terms. So a lot of the times when we've been out in community and we've discussed with people why perhaps they're not accessing sexual health clinics or they're not going to particular services, they are educating themselves on their own terms, but there is still a disconnect in terms of actually testing, which is a really crucial element. Would you like to add some more to that, Jeff?
Yes, I think so. Um, sorry, I can't see what I can't see properly this.
So it just says in sometimes distrust and desire. So there's more of a desire for Black men to make informed decisions on their own terms.
Yeah, yeah, it is, because when they find themselves in situations where they don't have this information they need, this necessary information, how would they make informed decisions?
Mm.
You know, if there are no, if they don't know where the clinic settings are, they don't know where the services are provided, they don't know the people who are providing the services. If, for example, you know, you're immigrant from somebody from an immigrant community, we just come to the country, you cannot even speak the language, the health language barrier and all that can impact on your ability to access the service. If you're coming into the country and you don't even know your whereabouts, there's no form, you don't have any kind of sense of integration. um, how would you be able to get the right questions and answer the right questions that you have within you around your health, and you're considering how you can live and have a home and do other things, and health will not become a thing of concern for you at the time. So all that really, like you also talk about the mistrust, and you don't, for example, somebody who is here illegally, would think that, oh, going to a sexual clinic might just lead to me being deported. If they know you've got at the end of the day, when you get to these places, they would ask you for your immigration status and whether you're here legally and stuff. And we have to understand that the mass here should be far more important than their immigration status, because the health is important, because while they're here, they're having sex, they're engaging with people and all that, and there's a potential of them transmitting infections. So immigration status should not matter when it has to do with the well-being of an individual sexually. So I think all that impacts here.
Yes. Thank you for that input, Jeff. Um, so then the last point that we thought was very valuable to focus on moving forward, what actually needs to occur for Black men's sexual health. So in terms of the change of approach generally, there definitely needs to be more of a focus on culturally accessible information and advertisement. So seeing that reflection in advertisement and focus on Black people accessing, and in particular Black men making choices publicly, whether that's media or whether that's just on social media platforms or resources, making active choices, but also having the knowledge and understanding of why it's necessary to focus on including sexual health concerns as a part of your regular general health well-being. But then also community-led resources and training. One of the main experiences I definitely think we've had from working in the community is focusing on how us being in the community as Black people and then being in conversation with other Black people is essential in order for people to have that comfortability, and then to also be in co-production with us to educate others within their community and challenge stigma as they see it. And then lastly, I did just want to acknowledge one of the points that we brought up previously in terms of campaigns and in terms of on the other sides of it, in terms of clinicians or just sexual health clinics, the acknowledgement or redress of past historical experiments to engage and build trust. So there does need to be that element of focus on as to why we're talking about having medical racism being a factor as to why people are not accessing services, but the acknowledgement of that and building trust could be one of the key steps in order for people to have comfortability, in order to see actively what type of training or what type of conversations are happening within sexual health clinics, so that Black men in particular, but overall the Black community, feel comfortable to come into that space and not feel like they're going to get stigma or presumptions about their sexuality or stereotyping in terms of their sexual health practices and what services they prefer.
Yeah. And also one thing I want to chip in is that during during research that been carried out on men, and even with um, with the kind of administration that was going to be carried out in terms of sexual health prevention programs, we found that models that are utilized existing models that have been used on other communities, and with the expectation that that's going to yield result when administered on the BAME community or even the Black community. The approach, the mental approach, or the view, or the perception, or the philosophy of the Black man, especially from somebody from the American community, is quite different from an indigenous individual, or the gay community, or the gay white man community, who have a central place where they meet, and you can easily have access to information. People can just go there and give the information. With the Black community, we don't have that. We don't have that community where we meet, or the custom, because the Black communities or the American community are made of different, communities. You
Yes.
know, exactly. So they make a different communities who have their own, places of assemblage, and places where they meet up and hang out and all that. So it's very, very difficult to have an holistic approach and a comprehensive generalization of an approach that should be utilized on meeting these individuals or getting them to access um, um, services.
Yeah.
So we need to look at how better we can, interact with this those from this mega community, and seeing how they can be more engaged, to become more responsible about their sexual health, and yeah.
Yeah. Thank you so much, Jeff, today for your time and definitely for your input. I definitely think it was valuable. I thought that this was a really important topic to discuss, but also just to end on this note in terms of active progression that we can actually actively make within our community as sexual health professionals, and also for individuals if there's information that they want to access around general sexual health well-being. Would you like to give any of your last final words, Jeff?
Anyway, thank you very much for thank you, Kia, for having me, and thank you, viewers, for watching this video. I hope it's very helpful, and I hope it's going to inspire you as a man to be more responsive about your health, and become more engaging with clinicians, um, or any kind of sexual health services within your community. Living healthy is far better than presenting yourself at the hospital when things have gone worse. You can actually prevent than try to reverse something. Thank you very much.
Thank you as well. Thanks, everybody. Thank you for watching today.